Hello, good afternoon everyone. Can you hear me right? Sounds a bit better, yes? All on? Very good. So, my name's Andrew Allum. I'm the chairman of the TaxPayers Alliance. I'm delighted to welcome you all this afternoon for our session on automating the state. So, the broader context around automation and what's going on in the wider world, but we want to try as far as we can to focus on what that means for the state and for taxpayers and for public services. So I'll introduce our panel one by one as we go through in a few minutes, but I guess a few introductory thoughts just on this, because the TaxPayers Alliance put out a couple of papers around what's going on in automation. And of course, automation is not a new thing, right? We're not thinking, should we in the future automate? You know, it's been happening for a long time, and here we are in Birmingham. So think about the Industrial Revolution 200 years ago, that was automation. And what did it lead to? Well, vast increases in living standards, increases in wealth and in productivity. That's been going on since, and the jobs market, I think, at the moment in the UK shows the strength of what we're doing in that. We come from a thesis, though, at the TPA that the state is somewhat behind the private sector in this, and that things should be pushing faster and harder in the state towards automation, which should then be a win-win-win. And what do I mean? Well, a win for the users of public services, because things should be faster and accurate. A win for the people who were previously doing somewhat mundane jobs. They might not still have a job with the council or with the DWP or wherever, but there are better jobs to be had, and our labour market's very strong, and the private sector's calling out for people who are employable. And former state employees are employable. The evidence from 2010 and 11 shows that they did pick up when several 100,000 were let go from the state, as we all remember in the early days of austerity. They all picked up jobs. Right? They went on to the benefits roll and they came off within a few months. So they are, by definition, we have the experience employable and in better jobs, I think. That's the second win. And the third win is for the taxpayer. My colleague Ben has put out one of our first papers on this a few months ago, with a large scale of savings we think should be possible for taxpayers by automating these services. So, win-win-win, that's our view. Let's have that debate. So, first I'll turn to my right, we have Vince for employment, which is an important part of the contract. So, Alok, over to you, please.
Great. Well, Andrew, thank you very much. Can you all hear me, ladies and gentlemen? Yeah, brilliant. Well, it's heartening for you to start by saying that former state employees are employable, because I guess you could argue that people like I and George Freeman are indeed employed by the state currently. I mean, certainly you pay for us, so that's encouraging. But I think the theme today, as I understand it, that there are two parts to this. One is the impact of automation on jobs, all jobs, whether it's public sector or private sector. And the second, absolutely as you say, is that how do you automate in the public sector, make it more efficient, but also at the same time make sure that you're delivering for the people that we're trying to serve in the public sector as well. You're absolutely right that automation is not new. As you said, it's been evolving over the ages. We went from horse and cart to steam to automobiles, and that's a process that continues. And it's also worth putting in context in terms of the job market. I mean, you all know that we are at record levels of unemployment. We've had 3.3 million jobs created since 2010. And a couple of the stats that actually people perhaps haven't focused on is that of the jobs that have been created since 2010, 75% of these are permanent and full-time, and 70% of them are in high-level occupations paying higher wages. And I think that's a really important point to keep in mind when you hear some of the stuff coming from the Labour Party and the left. And also in terms of zero-hours contracts, there are less than 3% of jobs in the current economy in zero-hours contracts. So I think that's worth bearing in mind. So you're right, the jobs that are being created are actually largely good quality jobs as well. There have been all sorts of predictions about job losses through the ages, but what we do know is that after every industrial revolution, if I can call it like that, there are more jobs, but there are different types of jobs. And I think what also worries people a little bit is that, yes, we are net going to have more jobs, but where will those jobs be based? And I think that's an issue as well in terms of the regional discussion. And I think, again, you know, the changes in technology will also, to a certain extent, come down to human preferences. I mean, the reality is that, you know, you can fly a plane effectively without a pilot, but actually how many of us are going to sign up to be in a plane where there's no human being is in the cockpit. So I think there are sort of certain limits to this as well. But I agree that jobs are at risk, particularly routine type jobs. So there has to be a focus on higher value added jobs, and I'm sure we'll have that discussion. But just on the second point, to do with automating the public sector. Now in DWP, what we've been doing for the last few years, and this was Ian Duncan Smith's brainchild, of course, is universal credit, where we've taken 6 benefits delivered by 3 parts of government, rolled it into one benefit delivered by one part of government, the DWP. And what's been quite interesting is that you will have heard various bits of criticism over time about universal credit. Actually, even right now, before we've rolled it out across the country, the level of satisfaction is at the same level as people on legacy benefits. And actually, here's the point about efficiency. So when I go around the job centres and talk actually not just to the staff, but also the people who are claiming benefits, what they tell me is that this is a much simpler system. It's much more efficient to use. A lot of it is done online. In fact, 98% of people going and using universal credit do their interaction online. And at the end of the day, what we've done is got rid of various cliff edges. So actually, work does pay. So if you increase your hours, you don't suddenly fall out of the benefit system. You carry on getting your benefits. And the business case on this is quite interesting, is that for £2 billion worth of investment, we're going to reap £34 billion of economic benefit over a 10-year period. And then you also have, as part of the economic benefit, or separate the economic benefit, you have the financial benefit, which is of course savings in welfare costs because people are getting into employment, but also over £1 billion every year saved by eliminating error and of course fraud, but a lot of it error as well. So what I would say is that in DWP actually we are showing what can be done by taking a system and making sure that we do automate it, and that is delivering efficiencies not just for the state, but actually also for the users. But the one thing I think we have to keep in mind, I think it's really important, and the Secretary of State made this announcement today, is that we can't expect that absolutely every single person is going to be comfortable doing everything online. And so it's important we provide that support and the funding for that support to make sure we help those people as well. But I'm actually pretty optimistic about the future. I think automation is not something we should fear. I think automation is something that will lead to better jobs and more jobs, and I'm looking forward to the rest of the discussion.
Thank you very much. Very good. Next, I'd like to turn to my left, George Freeman MP, who's chairman of the Conservative Policy Forum.
Thank you. Is this working? Is this working? It's working. So if you agree with me that the European referendum result was as much a roar of domestic grievances and a series of domestic policy challenges and failures, grievances in the UK, as much as a balanced judgment on the jurisprudence of the European Union, then this debate is absolutely crucial, because unless we increase productivity, unless we increase living standards, unless we increase income, then we will not tackle the underlying challenge that is sweeping across the West and in some parts of this country, including my constituency, where productivity is low. Yes, we have a lot of jobs. We have done well as a government creating jobs, but we have too low rates of innovation, too low rates of productivity growth, and in the end that won't get us out of the post-crash debt lethargy of low income growth and higher rates of inflation. So somehow we have to break this. We've got to increase productivity, we've got to create more money, we've got to increase earnings, and we've got to continue creating jobs. So this debate goes right to the heart of whether we can indeed make Brexit a moment of inspiring renewal or not. And I think there are two sides to it, because there's both public sector efficiency, and it has to be matched by private sector, continued private sector job growth. I want to start with a story. So I had a career in biomedical research, helping to create companies to do incredible things in healthcare. I'll just make this observation: in that sector, time is money, and you have all the money in the world and no time. And I've now crossed to government, where we have all the time in the world and not enough money. And government tends naturally to delay things, because that's the only currency we have, whereas in the private sector, time is the absolute killer of productivity. You have to get on and deliver results. fast. And I want to say something about health in a minute. I'll just share a story with you. So I came to Parliament determined to try and drive a new debate about how we could turn the NHS into an engine of innovation, make it a crucible for 21st century smart diagnostics, smart drug discovery, harness the power of the NHS as an intelligent health system that could actually drive and support having a life science sector. And I went to visit actually my hospital, my local hospital in Norwich, one Christmas when everyone's dressed as Santa Claus and eating its pies and doing that thing. And I found a guy by the door in a Santa Claus outfit with a trolley, and I said, "What do you do?" And he said, "Oh, I move the patient records around." And he didn't know that I was the Minister for Patient Records and completely committed to the digitalisation of patient records. And I said, "Oh, that's fascinating. Where do you take them?" He said, "Well, we take them all over, from the ward to wherever the patient goes, it follows." I said, "Oh, that's excellent. So you mean wherever the..." He said, "Yeah, no, we go up and down." I said, "How many of you are there?" He said, 600 volunteers. I said, "Where do the patient records go? You know, these are the buff envelopes." And he said, "They go in the van." I said, "Well, where's the van?" He said, "Well, it'll be here in about 20 minutes. I said, "Well, I'll wait." And when the van came, I got in the van, a complete breach of ministerial protocol, and I went to the warehouse. And they were quite surprised because they were having their Christmas party. And the minister arrived, and they were literally blowing those things that go, and wearing hats and eating what's-its. And there were 250 people working the patient record repository, 10 miles of shelves. It's where all the hospital records are kept. It's quite a sight. And I turned up and said, "Look, I've come to put you all out of business." With a big smile. And I said, "Look, I mean it. Your talents are really not well used shuffling pieces of paper around in trolleys around the NHS. We need to digitalise so that we have one electronic patient record. It doesn't follow us, it goes ahead of us, so that when the ambulance arrives, we know who you are, we know your blood group, we can treat you intelligently. We shouldn't be employing up to 1,000 people in each hospital to keep pieces of paper." Once I described the vision, and I then had to explain what they were going to do, and I said, "Look, in a modern health service, we'll digitalise that bit so that the money we're wasting on hiring everyone to do this, they can actually do care. They can actually help people." And actually, the evidence throughout our history is that innovation, productivity, gets rid of some jobs and creates more. And I think we should, if we become in any way a party sort of aping Corbynism in terms of worries about technology, we are absolutely finished. We must be the party that embraces innovation and technology for better public services and then drives better job creation in the private sector so that we rebalance our economy where the public is properly supported by the private. And we have to be a party of optimism about that job creation. I want to put in just chuck in two radical thoughts, one about health, one about the Treasury, for where we might embrace automation. So in the future of healthcare, it'll be electronic patient records. Goodbye to all those people shuffling folders around. By the way, it's a major cause of accidental death, misdiagnosis, mistreatment, malpractice. We should be ashamed of it, and patients should be marching up and down in the street, not saying, "When are you going to digitalise health?" But why haven't you? Why haven't you done this? Why are you still relying on paper? It's a scandal. It's a weirdness of our politics that people get agitated when we say we're going to digitalise health. Very happy that at the moment we're running a cardboard and paper system which is not fit for purpose. But where health is going, it's not just electronic records, it's artificial intelligence-based algorithms. I recently went to see a trial in the NHS hospital in Manchester at the Christie, in the paediatric cardiovascular unit, little children who've had heart bypass operations. Normally surrounded by machines that go ping and plugged in to wires and cables, restricting their ability to move or play, and nurses, very intensive care at bedside. With the new system, there was one nurse for the whole ward with an individualised artificial intelligence-based algorithm, and the monitoring is all remote. There are no wires on the baby. The bed is not full of machines that go ping. Children are playing, they're in the nursery. These are 18-month-old toddlers. And the nurse is able to do her job with an individualised algorithm ping. So if child A has a slight arrhythmia, but it's normal for that child, there's no alert. If child B has an arrhythmia and it's not normal, the nurse is there in seconds. And that's artificial intelligence improving the quality of care and freeing up resources in the hospital. But it gets more exciting. Synthetic biology is harnessing cells as factories. So I went to see a factory for AstraZeneca at Macclesfield, makes one drug. That one drug It's responsible for 1% of British GDP. That's how important the life science sector is to the British economy. Quite soon we're going to be using cells as factories. Just hold that thought. Bye-bye bricks and mortar, bye-bye car parks, cells as factories. Cells to produce vaccines, cells to produce drugs by programming the cell to produce the drug that we want. This is an incredible revolution and this country can lead in it. You don't find anybody in the life science sector saying, but that's terrible. You're going to get rid of our factories. People know that that will drive profit, it'll drive more jobs, it'll drive more innovation. And in healthcare, we're running a healthcare model that's based on very, very high rates of staffing, badly run, underpaid. I mean, we're running a sweatshop health service with an incredible number of people working at the bottom of the pyramid on almost nothing, driven by the love of their fellow human beings in a pretty badly organised, dysfunctional, siloed healthcare system. They're the heroes of the health service. They're trying to deliver care in a dysfunctional system. And the dream we need to hold in our minds is a properly intelligent healthcare system where the people in it can actually deliver care, not push trolleys around late, pushing records up corridors where patients have already left. And I want a rather sort of radical thought. Imagine an automated treasury. So imagine, imagine a treasury that allocated money on merit, on productivity, on who's delivering more for less. I mean, imagine if you could, a government that issued a digital strategy digitally instead of on paper. When I was a minister, I was amazed that the Treasury negotiations about productivity and about allocations of money are largely done on paper, in prose, written by world-class Whitehall mandarins. It's not how a modern business would allocate resources. You'd start with data, you'd start with metrics, you'd ask who's succeeding. And the truth is, if you deliver more for less in the public sector, we typically give you less, and we give more to the people who are failing. If you ran a business like that, you would be bust. So I sort of asked facetiously, imagine an automated treasury, but what I mean is, imagine a treasury that allocated money intelligently based on data that demanded digital measurement of output before you went anywhere near it to ask for money. Imagine if the chief secretary, if Liz could say, I'm not even having a conversation with you unless you can show me your productivity metrics, show me what you did with the last bunch of money I gave you. And we're going to give more money to the people who are delivering more for less and less money to the people who are failing, and the good, successful people can take over the failing operation. You'd embed productivity right at the heart of the way we allocate money. So there's a radical thought for you, an automated treasury and a health service that cared.
Thank you very much. It's a rather strange description, I have to say.
Leafy and Labour, shall I call it that?
Let me explain. I will say just, if I may, just a few words about Enfield. Sorry, can you hear me now? Yeah. That's good. Okay. If you wouldn't mind, let me just say a few words about Enfield, because you probably aren't familiar with it. It's a northern borough. It's a unitary authority. It's been controlled by the Labour Party for the last 2, now 3 terms. It's a huge area. It has a population of 330,000, which places this as one of the largest urban groupings within the country. It's not as big as Leicester, but it's bigger than Coventry, it's bigger than Newcastle. This is just one London borough. We spend over £1 billion a year, which is a colossal amount of money, and we employ thousands of staff. Now, my role is the deputy leader of the Conservative group. I'm also a councillor in Cockfosters ward, which is one of the leafier areas. Most of Enfield is not leafy by any description. It is a huge urban mass, really. It has a very diverse population, and it has it's almost a microcosm, really, in many ways, of the country as a whole. Okay, so the background to this, we're talking about the automation in the public sector. I'm talking about a local authority in particular, because I think these are huge organisations and it's an interesting subject. What happened, of course, as we all know, after the crash in 2008, there's a major government crisis across the Western world and in the UK. We had a Conservative government. It decided that it needed to cut back very hugely on public expenditure. That was absolutely the right description. Not the right description, it was actually the right thing to do in the circumstances. Now, for various reasons, strange reasons, I think, local government took more of these reductions in income than other sectors. I know the armed forces also suffered tremendously. Doesn't matter in a sense, because that's all water under the bridge. Now, Enfield was faced with very substantial reductions in grant from government, and it had to decide what to do. And it had various options, and what it finally chose to do was that it was going to digitalise its services, not actually the collection of waste or filling potholes, but the interface between local residents and the council. The council receives, as you'd expect, thousands and thousands of inquiries about various things every year. Now, so over a 5-year period, and I was involved in a review of this particular process, so I know a little bit more in detail than perhaps most of the councillors, in fact many of the senior officers as well, I would suspect. Consultants were recruited and off we went. And the idea was to achieve a substantial headcount reduction, and after about 5 years we did. I think it was 17% by 2017, which was intended to be the end of this process. So that was an achievement. The thing is, what were the costs of this? And this, I think, is what is interesting, really, in many ways. For various reasons, the officer, Cllr, particularly the chief executive, became obsessed with achieving the headcount reductions that he'd been tasked to do. And the thing that was forgotten was, of course, the customer. The reduction in staff was handled not terribly well, but not as badly as it might have been. There were very few people who were just told to, collect your cards and leave the building. People were redeployed, they retired, they moved to other jobs, and so on and so forth. So it wasn't tremendously painful in that respect. And also we have very high levels of employment in Enfield, as we do across London. So it was a good time to do this process. So there wasn't a huge amount of pain as far as the staff were concerned, though obviously there were many unhappy people, but that is part of the fallout of doing something like this. Now, what we discovered when we did a review of the services, and there are a large number of services, there's planning, there's benefits, council tax benefits, housing benefits, the range is endless, safeguarding, and so on and so forth. What we discovered was that customers who've been used to, if they had a problem with their council tax bill, for example, would contact the council and they would sort it out, and it might not be a particularly efficient process, but at least they get an answer at some point. Of course, with large reductions, often with very experienced staff, they found themselves in a sort of labyrinth of a digital system which they couldn't possibly understand. And therefore, people who would call in would find themselves waiting very long times before they could get through, if they could get through at all. If they tried to use the website, they would find it more or less incomprehensible. I mean, I did quite a lot of work, really, myself trying to access the website in order to understand it. And I couldn't understand how to get through to many of the services. So I was not surprised that other people also felt the same. Now, so it was a wrong strategic direction. Instead of the customer being at the centre of the process, the reductions in numbers became the centre of the process, and this was a fundamental mistake. And the relations between local residents and the council went downhill very rapidly. As you know, residents don't have a very high opinion of the council, generally speaking, and in Enfield, their opinion of the council went, more or less collapsed. Now this is not a party political issue; it's a managerial issue. I think we agreed that this was a reasonable thing to do. It was the way it was done that we had problems. Now, we have a new chief executive. The old chief executive retired, so we've got a new broom, so to speak. He understands that there needs to be a customer service strategy, and that the officers have to understand what that means and how they can put it into practice. We've learned that relying on consultants who talk about systems that the senior officers simply couldn't understand is not without in-house expertise, you're asking for trouble. I'll give you one example. We had two consultants who effectively almost took over running the council as they digitalised everything in sight, and they both left the council on the day that the system came into operation. Clearly, this was not good news. And then further people had to be employed. And then they left, and so on and so forth. So there wasn't really a proper improvement. Now, I'll finish by saying that the other aspect of this, it wasn't simply that people were unable to use these systems, they didn't know what to expect from them, but people who were elderly and vulnerable, who would use the council perhaps more than most, were the people who were most affected. And they were completely at sea with this system that this council, that they couldn't communicate with, they couldn't engage with in the way that they used to engage with. Now, so I would say that by and large, although this wasn't a total failure, we're getting there, but it will take probably years to sort out some of these problems. The council has an immensely complex organisation. It has hundreds of electronic systems for virtually everything. Many of these systems don't interface with each other, or they're out of date, they need changing, they need replacing. So this is a very long-term project that needs to be managed in a systematic way, and it wasn't, basically.
Good. Thank you, Edward. Thank you. Right, and finally, my colleague Ben.
Yes, thanks, Andrew. I'd like to echo what the other panellists have said, especially in terms of the massive benefits we can get from automation in the public sector, and not just in the public sector itself, but also for the wider economy in terms of productivity growth, economic growth stemming from that, and also the cost savings for taxpayers. So our research, the TPA, has shown that by 2030, up to 850,000 public sector jobs can be automated using currently available technology, which would bring in cost savings, staff cost savings of approximately £17 billion a year. So there's obviously huge potential there. But I'd like to focus in on two things in particular. The first one being the NHS, and carrying on from what George was saying earlier. If you look at the news, the NHS is seldom out of the headlines. And if you believe the headlines, then the NHS is never more than a week away from collapse. Doctors and nurses do fantastic work in the NHS, and the NHS gets lots and lots of things. They do lots of things really well, but also it does things badly. It's towards the bottom of the league tables for things like cancer survival and strokes. I think we're below Slovakia when it comes to cancer survival, which is just unacceptable considering how much money we spend on it, and yet it's still seen as one of the best systems in the world. I think as The Guardian put it, without any sense of irony, the only black mark against the NHS is its record of keeping people alive, which is says everything you need to know. And the main flaw in the NHS is very low productivity, very low efficiency. And one of the reasons for that is its failure to embrace automation and technology. So following on from what George has said, our research has found just quite shocking examples of trusts using Windows 98 as its main operating system, which is just obviously ridiculously inefficient and exposes the NHS to potential cyber attacks like we saw last year with the WannaCry. Examples of doctors having no way to share patient records. They have to use WhatsApp or Snapchat even, which is just not secure, which jeopardises patients, and as George already said, risks patients' health outcomes. So what we're calling for at the TPA in our research is a massive acceleration of automation in the NHS to improve patient outcomes and also to save costs. So we've calculated that it can save, by 2030, approximately £12.5 billion a year, which will obviously benefit taxpayers, and that's money that can go back into the NHS, helping and improving patient outcomes. And as George also pointed out earlier, you free up the doctors and the nurses and the other healthcare professionals from doing the more repetitive, mundane tasks, actually focusing on what they really want to do and love, which is patient care. And the second thing I'd like to focus in on is social care. Currently the system is overstretched, and given that we've got an ageing population, by 2060 the model will be unsustainable. So if you want to continue to provide good quality care, again we need to embrace automation. There's many examples from around the world, and in the UK as well, of great companies offering exciting, innovative products which actually free up carers from, again, the more mundane tasks such as data entry, or the more awkward or embarrassing tasks such as helping patients to get dressed or to bathe or to go to the toilet, to actually help them to focus in on patient care. And we've also calculated that by 2030, with advances in technology, that will save the care sector about £6 billion a year. So again, automation offers great opportunity to improve social care and also to cut costs. And these companies are already operating in the UK. London in particular, and Cambridge and Oxford are massive tech centres. These companies are already here, offering fantastic services. But one of the biggest problems is there are many barriers to entry in the NHS. We found examples of certain trusts having different examples of what is considered good practice. So one company might come along with a great product and they demonstrate that it may reduce error or improve care in one way, and it's been shown to be effective in one trust, but then they go to a different trust and they've got to prove it all over again, which has represented a huge barrier. And we've also found, especially in the NHS, people just often quite suspicious of using new technology, which again makes them more reluctant to embrace it. So what we're calling for is, again, rapid uptake in automation, considering how we can remove these barriers to entry, and also providing the training, the skills we need, because we've got people who are leaving school, leaving university, who are ill-equipped to be able to engage with the new technology, which will save lives and lower costs. So that needs to be addressed, and yes, that's me.
Thank you, Ben. Right, and thank you to all of our panel.